South Africa has had 7,497 COVID-related deaths. Our confirmed cases are now at over 470,000, putting us fifth highest globally for infections. The Western Cape was the first province to see a spike in numbers, but now it seems they may be through the worst. While they still have the highest provincial death toll, that's 2,983, their active cases are lower than Gauteng and KwaZulu Natal. I'm joined now by the Western Cape's Head of Health, Dr. Keith Cloete. Good evening, Doctor. Thanks very much for your time. Your active infections are about third highest, still at around, I think, around 17,000, so that's fairly high. But is that figure slowly dropping every day, or is it still growing?
Good evening, Sally, and good evening to the viewers. It is dropping, so the active cases are getting less. So we are overall, the total number of cases and active cases are slowly declining, or the rate of new infections are declining. Also, our rate of admissions of people requiring hospitalization is stabilized and that's also declining, as well as the reported daily deaths, that's also showing a decline.
I remember those conversations when you would tell me which hospitals you were most concerned about, which hospitals you were at capacity. Are any hospitals in the province in distress because of COVID-19 this evening?
The only hospital that is close to distress is actually George Hospital, and that is the region that has that had the increase in cases the latest. So in the Cape Metro, all hospitals have occupancy around about 70 to 80%. So there's quite spare capacity in the hospitals as they stand in the metro. That's private and public together. As I say, the only area of concern for ourselves is the Garden Route area, because they were the last area in the Western Cape to show an increase in cases, and therefore also an increase in hospitalizations in George Hospital as we speak. Yeah.
All right, so George, of course, is the centre, the biggest town in that area, biggest city in that area, and you say the hospital there is taking serious strain. Just how bad is it? How many people are in ICU there this evening?
Well, the ICU is close on full capacity, and same with the private hospital in George as well. So we are putting plans in place, firstly to support them with additional ventilator capacity, and secondly we're also looking at deploying staff to go and help in the George area.
What do you think happened there? It's quite a spread out area. Anyone who's travelled the Garden Route knows that there's lots of smallish towns. George, of course, is the bigger city in the area. But for so long it seemed like they would escape even a bad peak.
Yeah. The only thing that's happened in the Garden Route area is what we've actually seen in every other part of the Western Cape, and that is a slow trajectory and increase in cases, and they are moving towards what we regard as a surge for them in the area. So that has been the pattern that we've seen everywhere else in the Western Cape. And just because they're the latest to start, just together with Central Karoo, for a long time Central Karoo had no cases, they're also showing some increase in cases. And it happens to be that it is just later than the rest of the Western Cape, but it's a pattern that we've seen before, and we are helping and supporting and making sure that everything is in place to be able to cope in that area, but it's a very similar pattern that we saw in the rest of the Western Cape.
And as you say, the Cape Metropole area is actually through the worst now. Obviously, you are on high alert for the second or even a third wave. We know globally this is something that does tend to happen. What are the signs that you're looking for? Is it simply watching those daily numbers like a hawk, or is it about looking for cluster outbreaks and clamping down on them quickly?
I think, Sally, what we've learned in that first surge has stood us in tremendous stead. So we're doing a formal review of all our systems. It gives us a good opportunity to learn where we've done it the first time. And what we will be doing is a combination of what you just said. It is really watching the numbers on a daily basis. We're now in the habit of watching what happened in the last 7 days compared to the previous 7 days. Any upswing in cases we can see, and we can pinpoint it actually. And we got teams in each of the geographic areas whose job it is now to pinpoint at a very localized level little pockets of where this is. So our big thing to look out for is what happened to us the first time, is to recognize the cluster the first time it appears. So for us, the big event now is to have a very strong containment strategy for the next 12 to 24 months while we await a vaccine. And it's really to say this is the time to heighten our awareness, to drive the behavior change. mask wearing. We're going to have a mass drive to distribute masks, hand washing, surface washing, and then social distancing. So we're going to put a big drive on that, but we're going to watch out for clusters and we're going to respond quickly. We've had a very successful call center and an automation of results and communication with contacts and following up with everybody. So we're learning from all of that. We're reinforcing our systems to even do it better for the next time.
You know, you're saying 12 to 24 months. It's just a reminder this is absolutely a marathon. And I think this evening of hospital staff, and I'm just wondering how they're doing, how many you've lost to COVID, how many are still infected, and also in terms of mental state and physical state, they must be absolutely shattered.
It's been an incredible journey, and I completely am humbled by just the wonderful, compassionate people we have that work in the healthcare system in the Western Cape. And we've had all these stories of anxiety and fear. And in a sense, we've had over 4,000 positive cases. We have lost 26 of healthcare workers. That's the numbers we've lost in the Western Cape. But again, the recovery rate is so high, and people have come back to work, re-energized, committed. We have such wonderful stories of people that come through this. And although people are exhausted, there is this absolute outpouring of compassion. And the best of humanity has come forward in terms of this. So there's this wonderful stories of the people. And we have had this wonderful journey with our organized labor colleagues, where we understand one another, we have deepened relationships, and we have respect for one another. So, Sally, it is people are exhausted, but the healthcare workers in the Western Cape has got a special story to tell about coming through this on the other side and really be filled with gratitude and compassion for one another and for the broader society.
Well, thank you very much for that update. Western Cape's Head of Health, Dr. Keith Cloete.